for the delay.
So let's start. I think we have already receiving colleagues and the friends joining our event, our workshop. Good morning, good afternoon, everyone, dear colleagues, friends. Welcome to our workshop on providing care through a social and solidarity economy, an inclusive model for advancing decent work, gender equality, and quality care services. This is Özge Berber Ataş. I am the moderator of this workshop. I'm the gender equality specialist, and I would like to begin briefly introduce the core concept of the workshop today. So, celebrating the International Year of Cooperatives this year, we will share with you the inspiring country experiences from different countries delivering care through cooperatives and other social solidarity economy entities in Colombia, in Zimbabwe, and the occupational Palestinian Territory, and also across the regions. So our discussion will certainly be enriched by your active participation and reflections. This webinar will not only give us the opportunity to discuss the vital role of cooperatives and the SSEs in care provisions, but also decent work for care workers, and also it will facilitate a cross-regional dialogue and knowledge exchange among ourselves. So our experience has shown that by involving care recipients, care workers, families, and also communities in governance, cooperatives and the social solidarity entities can improve the quality of care services, strengthen the social ties, but also promote the decent working conditions for care workers. So, and let's also remind ourselves that yesterday we have marked the 14th anniversary of the adoption of the ILO Convention on Domestic Workers, which was also celebrated worldwide. Our workshop will explore how these innovative models that we are going to discuss today in our workshop contribute to the sustainable and gender-responsive care systems in worldwide. So before diving into the discussions and the presentations, let me quickly go over some housekeeping rules for us to ensure smooth and productive webinar for all of us. Please note that our webinar will be recorded, and the recording will be available in 3 languages, English, Spanish, and Arabic. And our colleagues will take photos during the workshop, and we would really happy to see your keeping your cameras on, and we would like to see your beautiful and smiling faces during the workshop. And please make sure that your microphone is muted and during the presentations, just to minimize any background noise. And you will have the opportunity to raise your questions during the Q&A session, but also please feel free to post your questions to the chat box if you have anything immediately asked, and then we will take care of those questions during the Q&A session as well. And if you have any technical difficulties, please drop a message to the chat box as well, again, to contact us for our technical support. So our session will begin, our workshop will begin the opening remarks. First opening remarks will be delivered by Simel Eşim, the head of Cooperative Social Solidarity Economy Unit of the ILO, and also the chair of the UN Interagency Task Force on the Social Solidarity Economy. And then we will proceed with Laura Dati, the maternity protection and work family specialist at the ILO Gender Equality, Diversity and Inclusion branch. So following the opening remarks, we will move forward with the distinguished speakers, as I mentioned, from different countries to deliver their presentations. We will start with Carolina Pava, our national project coordinator in Colombia, and she will give us a highlights on the Colombian experience when it comes to the focusing on strengthening community care services for indigenous and Afro-descendant territories through the cooperatives. And then the second speaker comes from the ILO's Jerusalem office, from the occupied Palestinian territory. Yonis Sibe, and he's the National Project Coordinator of the ILO. And Yonis will talk about the role of trade unions in provision of care services, childcare services, and highlight the critical challenges and the obstacles they face in the implementation. And then we have Audrey Sharamba, from the National Program Officer from ILO Harare office. And Audrey will share with us her reflections on Zimbabwe's experience in provision care through social solidarity economy entities. And then the session will be wrapped up by dear colleague Bharti Birla, the Enterprise Development Specialist of the ILO December Country Team for South Asia. And she will share with us her reflections and the comments based from her experience in the South Asia region as well. Last but not least, our workshop will conclude with launch of the ILO Care COOP tools by our dear colleagues Ryan Kudia, the technical specialist in cooperatives and the social solidarity economy department, and also Mia Toma, the junior project officer on care policies from the ILO Gender Equality, Diversity and Inclusion branch. So let me congratulate our colleagues as well for the launch of these very important tools from which will come out today, hopefully. So let's start our discussion. The floor is yours, Mel, for your opening remarks, and you will have 3 to 2 minutes for the remarks. Over to you.
Hi, Simel, you're muted.
You're muted. Okay, I shall welcome you all again. Thank you again. Thank you all, our partners, country teams, and participants for joining us today. Happy to be with you in this webinar. And it's, in fact, a part of a series of webinars marking the second International Year of Cooperatives. We started with the platform economy, and then this one is on the care economy. The next one will be on the informal economy, and followed by crisis and response and child labor and supply chains and OSH, improving child labor conditions and OSH in supply chains. This of course comes, this webinar this year comes at a time of intersecting crisis, conflicts, disasters, structural inequalities that are also deepening the care gaps and widening decent work deficits. And in this context, we are seeing cooperatives and other SSE entities that are grounded in democratic governance and dedicated to collective and general interest, important conduits in advancing social justice, democracy at work, and a human rights economy. In fact, our work on this area has started in 2015 with a global mapping on care provision through cooperatives. That early foundation has shaped a decade of engagement, supporting research, national dialogues, and then pilot initiatives toward scaling up these community-based solutions, including through development cooperation. And you will hear about them today. What we have learned during this time is that co-ops and other SSE entities are quite well placed to improve working conditions and deliver quality care services because of how they come about, excuse me, how they work, who they work with and for. This democratic participatory governance helps create buy-in with caregivers, recipients, local communities, and having a say in setting the needs, priorities, financing and delivery mechanisms. It's a lot of work, this kind of participatory, of course, decision making. It requires trust, it requires know-how, but you'll hear from our colleagues as they share their country experiences. But once we get it right, they can really facilitate the participation in development at all levels, especially for people in situations of vulnerability, promoting social and economic inclusion and autonomy. This is, of course, especially important for women who make majority of both paid and unpaid care work around the world. Just to say that all this work is, and our approach is very much anchored in ILO normative frameworks, recommendation No. 193 on promotion of cooperatives, the ILO 2022 resolution on decent work and the SSE, the 2024 resolution on decent work in the care economy, and recent UN General Assembly resolutions on for promoting the SSE for sustainable development. All of these feature care economy and provision of care through the SSE prominently. You heard about the tools. We are very excited about them, very much co-developed with local actors to design, implement participatory, gender-responsive care co-op SSE models as local solutions. And it's an important moment for us to reflect with you on how we can move this work forward on provision of care services beyond pilot initiatives. We are also very cognizant that care economy is only one area where SSE solutions at the local community level are much needed. We are seeing this in other pressing areas like elimination of child labor, advancing occupational safety and health, crisis response and formalization, and not that these are separate silos. There's, of course, a great deal of overlap, including formalization of care work through co-op SSE, which, again, we'll talk about. Apologies if I went over my time, Özge, but before you pass the floor on to Laura, I just want to say this work would not have been possible if it was not for the partnership. We've been pooling resources from here and there to make this going. There's not like one pot of resources that we have been tapping into. There's a lot of labor of love and passion involved. But it wasn't only co-op SSE and the JEDI, Gender Equality, Diversity, Inclusion branch in headquarters working together, but it is people like Özge, people like Barty who are here, gender and enterprises specialists on the ground who have seen the value, taken this on and pushed with all their might. We're very grateful and we very much hope to build on that. Thank you, and over to you, Özge.
Thank you, Simel. This is such a wonderful, energetic start of our discussion, and thank you very much as well. And also highlighting the key, let's say, global frameworks that is also grounded on our efforts in the field as well. So let's move to the Laura, our maternity protection and work family specialist, for her opening remarks as well. Floor is yours, Laura.
Thank you, Özge. Thank you, Simel, and dear colleagues and friends. Thank you for joining us. I would like to be very brief, but use this moment to celebrate this important milestone for our teams and emphasizing why it's so important that we come together to join our efforts on the care economy in the framework of the cooperative and SSE entity. Simela has put it very clearly. We face a global crisis. We know that both paid and unpaid work remains largely invisible, undervalued, mostly carried out by women and girls, but is foundational for our economies and societies. We have put together research and data to really build the evidence that we need to act urgently and put together the efforts of all the actors of the economy and society to transform the care economy. We estimate that 740 million people are outside the labor force due to unpaid care in 2023, and 708 million are women. Over 2 billion people lack adequate statutory maternity protection, parental, paternity leave, and quality childcare services. Also, we know that many paid care workers, we have heard domestic workers, but migrant, community health and care workers, workers in the informal economy, face poor wages, informal working arrangements, limited protections, including the very care policies we're talking about, and face significant discrimination, violence, and harassment. But we know that investing in care is transformative. It can create up to 300 million jobs by 2035, promote women labor force participation, closing gender pay gaps, boost productivity, and foster more equal societies. And these important visions has been affirmed by governments, workers, and employers through the adoption of the ILO resolution on decent work and the care economy last year, as Simel has indicated. And this resolution is very important because it affirms that care is essential to achieving social justice, gender equality, decent work for all, and it calls for urgent action and investing in the care economy. And this resolution also points out the important role of the social and solidarity economy, including care cooperative, calling for inclusive, community-based approaches to care, and recognizing that SSE's entities are important players of the care economy by filling care gaps, but also creating decent jobs, improving working conditions, and meeting the diverse needs of families and community. And also the resolution acknowledges the role of cooperative and other SSEs entities, among others, in the investment in sustainable and modern care infrastructure and provision of care, of training and employment opportunity. So we're very excited from JEDI to be here today to hear about these important country experiences and also to launch these tools that are really been a labor of love and the result of consultation, piloting, a collaboration among experts, international experts, but also the labor of love on national coordinators around the world. That we really thank you for having made this work possible. So also let's reflect to also ahead of the Financing for Development conference in Sevilla, not only on what works, but also what more can be done to scale, to support, and also finance quality care provision through these people and community-centered, innovative, and sustainable models. So we can really leave no one behind. Thank you very much. Over to you, Oscar.
Laura, thank you so much. As you said, yes, investing in the care economy is really transformative, not only because of the employment, the potential for the employment creation, but also for the equitable societies and for well-being of all people around the world, including all of us. So, and it is the good question, what can be done more? So with these presentations from different country experiences, now we will have the opportunity to explore what has already been done in different countries and what can be done. We can discuss all together. So let's move with the presentation of Carolina from Colombia. She will be presenting us the strengthening community care in indigenous and Afro-descended territories through social and solidarity economy in Colombia. So the floor is yours, Carolina. Please go ahead.
Thank you very much. Well, good morning and good afternoon or good evening, everyone. Thank you for joining us today. I'm pleased to share some insights from the pilot experience in Colombia. Please, next. Okay. First of all, why care in Colombia? What can we say here is Colombia is currently at a significant turning point for care policy. The creation of the national care system led by the vice presidency represents a major opportunity to recognize, redistribute, and reduce the unpaid care work and professionalize care work, opening the door to reward and represent paid workers. With support from the ILO pilot programs, we launched to build the system from the ground up, starting with the community-based models that reflects the needs of women, indigenous, and Afro-descendant populations. The approval of the Colombian National Care Policy policy in February of 2025, give this initiative a formal structure and a budget over 6 to 6.2 billion USD dollars across the around 10 years. Please, next. Next. Thank you. Which are the challenges and what we have found here? At the same time, Colombia faces deep and structural territorial challenges. There is a high burden of unpaid care work, disproportionately carried by women. Much of the care sector remains informal, lacking social protection or decent work conditions in the sector. In rural and ethnic territories, armed conflict and violence have also affected the provision of care, limiting the care services and placing additional burdens on already vulnerable communities. For example, in the study we conducted, midwives requested for us to identify teachers that would allow them to carry out their work safely in the community without facing any risk with the armed groups. There are major gaps in the infrastructure and public investment in care system across these areas. Addressing this requires policies grounded in the territorial realities, and also having an intersectional equity and voices of caregivers themselves. Next, please. So, which were the implementation steps in the process we had here? The pilot in Colombia followed a bottom-up process. It began with a needs assessment that contributed directly to shaping the national policy. We partnered with 2 local organizations, a midwives networks in Chocó, called As Already Part Chocó, and a group of women weavers in the Sierra Nevada de Santa Marta called Yosa Constructora de Paz, to co-design care strategies rooted in their knowledge and community practices. These strategies included creating community care houses or care spaces, delivering training, and designing participatory organizational strengthening plans. In the Sierra Nevada, for example, weaving and crafts provide a path to economic and autonomy for women, supported by the Ancestral Care Center, which helps to reduce their unpaid caregiving responsibilities. And well, please next. Okay, some reflections of the process. Partnerships are the key element of this process. Collaboration was essential to success. Efforts were coordinated with the national government, first of all, represented by the Vice President, and next with the Ministry of Equity and Equality. Also, public institutions such as SENA, the Learning National Government Institution, and also the ICBF for the welfare of the children, local health authorities, regional and local governments, trade unions, and international cooperation as well. Experiences from the pilot were shared in international space, for example, in Santiago de Chile the past May with indigenous leader at the conference on cooperatives, and also creating learning exchange with Honduras and Bolivia that we have created around the region. Please, next. Okay. I know, please, the last one. I think it is. Yeah, no, last one. Yeah, some reflections. Well, several lessons emerge from the pilot. First, care strategies must be participatory, designed with the communities, but not for them. As a result, it becomes possible to, for example, to open the discussion on the distribution of unpaid care work between men and women in an indigenous community, for example, or to promote a shared understanding of the concept of decent work, which is very important for this project. Second, building care initiatives through the social and solidarity economy increases local ownerships and also the sustainability of these kind of projects. And finally, aligning local actions with national policy tools, like for example, the women's funds that can leverage visibility and additional resources for the projects, has been like a good practice, and they could apply to this women's fund because we prepare them to be part of this kind of programs. So it's like something that we would like to highlight. Next. Now, yeah. Looking ahead, we plan to support the implementation of customized COOP care tools across pilot communities. They are creating now the care spaces or care houses that they are creating right now. Also, we expect to expand the training of trainees module for replication in the public institutions. We involve public institutions in this first training, and we hope that we can expand this training in other institutions. Also systematize findings to inform national level scaling and also to provide inputs for the national care policy. And we are trying to deepen collaboration with labor unions to explore the formalization of care roles and, for example, to create labor unions around the care sector and the representation of the care sector workers. And the ultimate goal to ensure that community-led models of care help shape the future of Colombia's national care system. And we hope that these inputs will be very helpful for the programs and the projects that Colombia and also the cooperation can create. And well, finally, and I'm running so fast because we had only few time, but if you have any questions, thank you very much for your time. I'm happy to take deeper into specific components of the pilots. Let's continue building care systems that are inclusive, community-driven, and grounded in social justice and decent work. And thank you so much.
Carolina, thank you so much. This is really a very interesting case from Colombia and showing them how important to invest in the community-based care services as well, particularly for those living in a very vulnerable situation, and to be able to also increase the services, the quality of services, and the access to those care services as well. Thank you so much. And you have mentioned the importance of engaging with trade unions as well in providing such services. And now we will be moving to another presentation to be delivered by Eunice from occupied Palestinian territories, but who will be also explaining to us the role of trade unions in actual provision of care services, childcare services as well. So Carolina, thank you so much. And we will have more time to discuss, definitely, please. So Eunice, it is your turn now. We are very much excited to hear from your experiences and also all the challenges and the difficulties that you are facing, but also how you are brave to deliver such very important, let's say, services to your people. So please, the floor is yours.
Thank you, Odika. Thank you, Semil. Thank you, colleagues, constituent, partner, and joining us. Really, I am happy and pleased to introduce a new initiative related to establishing child care cooperative by the ILO and trade union and OBT. which aims to provide affordable, high-quality child care, even during a time of a crisis. This is a new cooperative model is led by workers and help families by offering dependable child care and creating decent jobs. We are responding to what many women have told us. We want to work, but who will care for our children? Child care cooperative offer a real solution through empowering women, caring for children, building resilience by community-run child care centers near workspace, help women stay in or return to work, create fair job opportunity, especially for young women. Next, please. Yes, the impact of the war in cooperative as well as the child care in Palestine. Since October 7th, the war has had a devastating impact, not just on lives, but on livelihood, services, and community resilience. Over 90% of the population has been displaced, tens of thousands killed or injured, basic infrastructures, including health, education, and food system has collapsed. For cooperatives, particularly those providing critical service like childcare, the damage is catastrophic. 80% of cooperatives in Gaza have been affected, some completely destroyed. This leaves working family without job, women without support, and children without care. The path to recovery must include rebuilding these social and economic structures with a cooperative at the heart. Next, please. Based on our assessment study, we have 4 modalities of child care and OBT. Despite the demanding need, there are no public nursery or child care in Palestine. Family relies on home care, private or semi-informal nurseries, many of which are unregulated, under-resourced, and offer limited quality or safety. There are no public nursery and OBT. Care for children from 2 months to 4 years of age provided by private institution. There are 4 types of the care modality in OBT. Home care with the extended family context, largely spread in rural community, and is usually offered based on a good family connection, basis with no or minimal financial cost. The second model of nurseries is home care nurseries. This type is highly predominant for its low cost and logistic suitability. It is expected that this modality counts for 60% of nursery care in the country. It's poorly controlled or regulated and sometimes considered as illegal. The third model is the private-owned nurseries. This type is well regulated and controlled while not standardized or universal in applying the concept of early childhood development and development care. These offer safety and quality advantage and represent a growing area of businesses. The fourth one is related to the institutions-based nurseries, which is a small number of nurseries were founded in a big firms like Jawal or Al-Najah University. This type of nursery can be considered as convenient and logistically appropriate model. Next, please. The challenge facing child care in the OBT is related to the lack of regulation and supervision, poor access for low-income families, absence of training, a growing number of unlicensed nurseries, gap in support for children with disability. As a result, many working women are forced to drop out of the labor force simply because safe, reliable childcare is unavailable. Next, please. Why we need childcare? To support women participation in the workforce, This model doesn't just support work for women, it creates a job for the woman and empower community and provide encouragement environment for children, provide reliable child care. Women can re-enter or remain in the workforce, reducing economic disparity and empowering them socially and economically. Second is to improve the child care quality through professionalized and regulated care services. Create decent job, especially for the woman, by formalizing the child care sector. This initiative create job with a fair wages and decent working conditions, foster child care development, high quality child care positively impact children thinking, emotionally, and social development. This model is built on solidarity and mutual support. It is not profit driven, it is community driven. Next, please. The steps taken by the ILO for establishing a new modality of child care. We started with conducting research into cooperative landscape assessment, which recommend the establishment of child care co-op, development a visibility study, which also confirmed the viability of successfully implementing child care cooperative and highlighted the anticipated positive impact it would be generated. It prepared a business plan that outlined the mission, services, target market, operational structure, financial projection, and strategy for sustainability. Delivered professionalization training to 18 young women to equip them with the necessary knowledge and skills as caregivers. Identified potential sites and partners. We didn't just design a model, we worked on the ground with the real woman, real union, and real data to make sure that cooperative is viable and impactful. Next, please. The key stakeholders.
Yonis, I think we can't hear you.
Sorry, do you hear me now?
Yes, now. Yes, please. And you have only 2 minutes to finalize your presentation. Please go ahead.
Okay, I'll try to go faster. Who are the child care? We just determined that and identified the founder through trade union, municipality, and local union of network, people ready to create solution for owner. We identified founder of the child care cooperative based on their needs, interests, and challenges. They are founder from working families, teachers, caregivers, service workers, employers, private sector, found industry, core member, Palestinian General Trade Federation Union, Nablus Municipality Electricity Company, supported by trade union and ILO to start supporting startup support, training, and technical assistance. This cooperative include real working mothers, and it is located close to their homes or workplace. This means easier access, shared transport, and even proximity for breastfeedings. Next, please. Current implementation modality, we almost submitted the requirement for registration of the COP for the establishing of the nurseries, and the website was launched to give information about establishment, and also we start awareness campaign while the capacity building is still pending and staff hiring are not yet started. Next, please. The key challenge we are faced is one of the biggest challenge has been the licensing process. This model is new and extend for 3 authorities, municipalities, and ministries. And of course, the ongoing unrest has delayed several logistic steps. Next, please. Next steps To make the child care cooperative operational and sustainable, we are moving forward in two parallel tracks. First, we will complete all formal procedures and prepare the physical space, ensuring that our team is trained and really ready. All this at the same time, we are engaging key partners, especially the private sector, for both financial and strategic support. A steering committee will guide the long-term vision and ensure the model grows beyond the pilot phases. Thank you.
Thank you. Thank you, Yunus. This is really excellent and very inspiring example showing the commitment of a trade union for provision and for supporting their members, men and women members in their parental role, I think, enduring even under such a difficult times and the crisis situation as well. So thank you so much for sharing this, a very inspiring example. So colleagues, thinking about unwinding of the time that we have available, let's proceed with the next presentation to the country case of Zimbabwe. Audrey, our dear colleague Audrey, will present the country case of Zimbabwe in provision of care services. So Audrey, the floor is yours, and I would very much appreciate if you mind the time and keep your presentation with 7 to 8 minutes, if possible. Thank you. Over to you.
Will do. Thank you, Özge. Good afternoon, morning, evening, everyone. So I'll just quickly jump into the challenges and opportunities for care work in Zimbabwe. Here we are focusing on providing care through the social and solidarity economy. And we're looking at the story of street vendors and domestic workers. Street vendors, it doesn't matter the nature of the roads, they are just vendors. Next slide. Just looking at the challenges and opportunities for care work in Zimbabwe, we noted that, as my colleagues have already said, I won't belabor that care work is really largely unpaid, and it's usually just given to women, and it's not supported in any way by public services. And that makes it very essential. So we all want to work. We all want to be seen generating income or participating on the labor market. But who is there to take care of care? Those of our members of our family, especially our children. And we note that the social solidarity economy here in Zimbabwe is really deeply rooted in the Zimbabwean tradition of, you know, I can't be an individual if I am not a member of a society. And so you find that already the Zimbabwean government has ensured that we have legislation that speaks to cooperatives. This is because there is appreciation that people need to be able to look after each other and look out for each other outside of steeped or articulated labor or job activities. So already we've had cooperatives like self-help groups and associations which have been based on different value systems. Some would call them burial societies, others will call them income savings and lending associations, but it's really about collective ownership for communal resilience. We've also noted that the challenge that we've had in terms of addressing care is the issue around labor force participation. I think that's the question that my colleagues have been asking. If I'm going to want to participate in the labor force, who is going to be looking after my children or my vulnerable people? And therefore, there's been that major gap. There's also high unemployment. Zimbabwe has is highly informalized. So you find that women tend to be the major component of the informal sector, and they're the ones that say it's easier to be able to carry your child on your back or to move around with your child as you're taking care of your work. Then as more women are engaging in the informal economy, you'll find that we have demand for affordable and accessible as well as inclusive care solutions. So now we need to be thinking around how can we make sure that we are able to support both paid and unpaid care responsibilities, because time is money. How do we move ourselves from one end to another? We'll go on to the next slide, where we speak about the care cooperative assessment that was done in Harare. The ILO, trying to see in advancing the decent work agenda, sought to say, how do we then address the issues of care? So a pilot study was commissioned, and this pilot focused on Harare as the city. Harare is the capital of Zimbabwe. And the findings from that study were that there are a lot of care opportunities. Our vendors would really appreciate being able to work with peace of mind, knowing that their children are well taken care of. Right now, if they have running battles with the local authorities, they have to be worrying about their little children, what to do. And those that have children with disability, oh, it gets even worse. And then there's also an opportunity for improving working conditions for domestic workers, because domestic workers are also people that need to be able to take care of their own care needs. We also noted, I think I've spoken to the supportive legal framework that already exists, so that is a great opportunity. But also in that breath, we noted that there's this huge gap. Now, how do we address the gap? There is need, therefore, for capacity building and awareness raising around issues of care and around using the cooperative model. How do we build in care within the context of the cooperative model? So while we have legislation, our legislation does not have room for care as a component of the cooperatives. How do we then ensure we address this? We also noted that there was need for multi-stakeholder involvement. And this is where we then had the validation meeting to ensure that we could capture the voices of government, the voices of workers' union, the voices of different informal economy networks, as well as CSOs and financial cooperatives. And after the validation of the findings of that study, we realized there was need for us to undertake a scoping mission to say, okay, we've done this study and we've identified these gaps in care. How do we then take care? How do we then address these issues? So we figured that the scoping missions would help us identify opportunities for piloting care issues or addressing care within the use of the cooperative model. We needed to know where to start. So through the Spotlight Initiative, some of you might be aware of the Spotlight Initiative that was about ending violence or gender-based violence in the world of work for us as ILO. So we constructed what we call the Safe Market Initiative. And the Safe Market is like a one-stop shop. And what it does is that it, can I ask us to move to the next slide, please, Susan? Thank you. What the Safe Market does, the Cheshingo Safe Market, what it then does is that it is a one-stop shop, and it has an infrastructure that is in place where there is a market, there is also an ECD center, there is a police post to enhance security, and there's also a GBV response center. So as we were reflecting on the pilot study around care, we felt the Safe Market that the ILO had constructed during Spotlight was quite the learning point, because it addresses care, because it has the capacity of having 80 vendors who are able to work without all the running battles, without worrying about the safety and security of their children. And so there is an ECD, or Early Childhood Development Center, that has the capacity of 50 children in that space. There is also access to water and sanitation, health facilities. So you worry less because you know your children are not under threat. Then the local authority buy-in, the local government, ensured that they provide security to the wares of our street vendors within this context. Therefore, our vendors are able to focus on business because they know that their care needs are well taken care of. I think I'll quickly go on to the next slide. So having taken the learning visit from Cheshingo, which is the model, we felt, if we want to replicate this, how about going into the other spaces around Zimbabwe? And also having had validation experiences from the workshop in Harare, we felt going to the different spaces would also enable us to see exactly what was on the ground. And indeed, we got to the different spaces, as you can see on the slide. We went to Gwanda, which is the southern part of the country. We went to Masvingo, we went to Mount Darwin, which is central, north central. We went to Nkai, which is also Matabeleland north. We are a teapot country. So if you can envision a teapot, you can see that we went to the different dots of Zimbabwe, and we noted that already there were cooperatives in existence, and these are multi-purpose. They mix agriculture and OVC care, and most of them are women-led, providing creches and home-based elderly care. We noted also that there's traditional networks which are complemented by already existing social solidarity economy models. And so we appreciated the integrated care and the livelihood models that are already being piloted by different actors in the different communities. So that graphic is just to show you the different aspects that we saw the cooperatives already doing: food processing, ISALs, horticulture, vending, culinary services, basketry, goats and chicken farming, a lot of other things that you could see from the different spaces. So already you can see that our scoping mission was already also validating and consolidating the findings from the study and further enhancing the need for us to undertake care in Zimbabwe and to see how we can address this in a manner that is viable. So if we go on to the next slide, you'll see the next steps, which is where we are at right now. We are saying we need to then strengthen our partnerships as the ILO, as we are thinking around introducing the notion of mitigating or addressing issues of care using the social solidarity economy. We already have partnerships with the Ministry of Women Affairs, Community, small to medium scale enterprises. We have a relationship with local authorities. Some of them we have already existing MOUs, and these are the high targets for us to see how we can push care. We already have a strong legal framework around the establishment of cooperatives. Perhaps we need to go into how we can ensure that the cooperatives have the element of care within them. We have a relationship with the Chamber of Commerce in informal economy actors. We are also already plugged with StreetNet International because the president of StreetNet International is actually Zimbabwean and is well plugged into the informal economy activity. We are working very closely with the Domestic Workers Allied Union as well as the Domestic Workers Association of Zimbabwe. So already we are appreciative of the issues at hand that are of concern to them. We feel
Audrey,
that even...
May I just, intervene, and could you please wrap up your presentation, if possible?
Thank you. So I'm on my last slide. So what we are also looking to do is a feasibility study in terms of care co-ops. What is it that we can do in a manner that actually adds value? And then, excuse me, the replication of the safe market, which we said is a one-stop center, we feel that this is a good example. Then, of course, we are excited about the launch of the Think Care Corp and the Start Care Corp tools. We feel that we are going to be able to use this even as we strengthen the capacities of our cooperatives. And we feel that we need to formalize the care cooperatives so that they are able to deliver care services. And then we also would be addressing some of the issues that were raised around being able to provide breastfeeding stations, care spaces, and learning centers. And last but not least, we need to be thinking around how best we can find financing for care cooperatives so that we have a holistic approach to improved livelihoods within the care spectrum, as it were. Uzge, I want to thank you for this opportunity.
Audrey, we would like to thank you too as well. This is such an interesting experience and example, and you have already highlighted very critical, aspects of building synergies with the local communities, with the associations, domestic workers associations, and also StreetNet, and directly engaging with the community leaders as well, and also benefiting from their experiences on already established initiatives in the country as well to have a better and stronger, let's say, new initiatives. And I really thank you very much for also providing the information on safe market initiative as well. And the last question you pose is very important, how to finance the cooperatives as well. This is I think, key question that we need to ask. So, okay, thinking about our time, let me move to Bharti, our enterprise development specialist from ILO work team for South Asia. I know, Bharti, you have also so many good examples and inspiring examples to share with us from the South Asia. So we would like to hear your reflections and the comments as well. You will have only 5 minutes. I'm really sorry for cutting your presentation a bit shorter. And also, colleagues, I would like to also just to remind you that in the chat, you see so many documents and the links for the documents that our colleagues are sharing. Please go into those documents and check the reports and all the reflections from there as well. So, Bharti, the floor is yours, please.
Thank you so much. I'm going to share some examples from Sri Lanka as well as India and some of the experiences that we had in setting up COPs and the process that we are following now. First I'll go with Sri Lanka. In Sri Lanka, as you all know, it's an aging society. There are a lot of old people who need quality care. And such care is not publicly available. If it's available, it's very high cost private care. Second is that there are highly skilled workers who are healthcare workers in Sri Lanka. We know that nurses from Sri Lanka go to all over the world, but within Sri Lanka, their possibility of using them does not exist because of the high cost of the private services. And also we have a lot of returnee migrants who are coming from different countries. They're highly skilled care workers and they need reintegration back into the society. And then, of course, we have a lot of domestic workers who want to move and have a career progression into care because they feel that care can offer them dignity as well as better working and living conditions. So there is a huge informal economy. There is a lot of opportunity for job creation, for bridging the informal formal divide, and also to provide for quality care services to people who need the most. So the process that we are following in Sri Lanka is a multi-stakeholder engagement with Ministry of Labor, Ministry of Industries, which has the cooperative department linked to it, and also with employers organizations, workers organizations, unions, as well as different cooperatives who are already there and working in close coordination with Department of Cooperatives. So we had a national stakeholder workshop to discuss the issue of care crisis and the possibility of looking at care and care social solidarity economy models to address some of the issues that there in Sri Lanka, and also build a very collective and comprehensive understanding on cooperatives and social solidarity economy. While we had some success, we also had some challenges because as many of my colleagues have also said, especially when we talk about caring for children, it's a regulated profession, and you need a lot of documents and licensing and approvals. So it's a process which is slow and expensive. And the employers who are ready to start childcare services, they're very careful about funding them, because they want a safe environment for the children, and they want certified trainers, which is again resource intensive. Unions have their own standpoint. Some unions are directly supportive of the cooperatives, while others believe that forming self-help groups or collectives or networks would be a better idea. So we are going with both the ideas in Sri Lanka. With some, we will be forming registered cooperatives of care workers, and with others, we will look at other models of social solidarity economy, like self-help groups, which follow the principles of the cooperatives. And we are also looking with existing cooperatives who are thrift and credit societies of healthcare workers, if they can extend these services of care not only for their members but also non-members. So we are looking at multiple models, multi-stakeholder model, where we want the government, Department of Cooperative, Women and Child, employers and workers to look at setting up cooperatives in EPZs or industrial zones. We are looking at extension of care services by existing healthcare cooperatives. We are partnering with unions and in some of the areas to look at how do we organize care workers and set up their own self-help groups or cooperatives, whatever the unions will feel comfortable with. It's a process. We have started with the national assessment on cooperatives and social solidarity economy, and we will be doing a validation workshop soon on this. So we have 3 or 4 initiatives, but of course, we also need to look at how do we keep them and sustain them in long run. Right now, they're being used, they're being supported by the existing cooperatives or the unions, but we also need to see how they will keep up in the long run. They might need more resources. Another example that I want to share with everyone is from India. We had trained a lot of domestic workers to move into care sector, done elderly care trainings, child care trainings with them. But one of the challenges that we were facing is that they were not able to get their skills premium. And also domestic workers, when they were bargaining with the individual employer saying that we've gone through household training, cooking training, you need to pay us more, they were not able to get the skills premium. And we tried to form cooperatives. So we work with 2 unions, Jharkhand Gharelu Kamgar Union, which is an affiliate of National Domestic Workers Union, to form a cooperative, and with SEVA to form SSE. And in both cases, we found that the workers were able to bargain better wages through collective negotiations and also get written contracts. So cooperative became a tool for engaging with the residents and resident welfare associations to have this collective negotiations and better wages for the workers. That was a good example where we could actually use cooperatives to get skills premium. Another example, yes.
You have just only 1 minute left. Sorry. Thank you.
Yes, I'm just going to finish this. So now what we're trying in India is also using the Think Cop Care module to also help the unions to decide what kind of a cooperative or social solidarity model they would like to establish. In India, for example, you can register the cooperative as a labor cooperative or a multi-purpose cooperative or a credit or thrift society. So this ThinkCop tool, we have pilot tested in India and in Sri Lanka, and it's been very useful in opening up the possibilities for the unions to think in different ways on how they would like to position and support the care workers. Last thing that I want to say is that we are also trying this ThinkCop and Think Care modules to develop cooperatives of care workers, care cooperatives in cotton growing communities for the agricultural workers, largely women farmers who also get into situations of who face a lot of decent work deficits in the cotton supply chain, and they do not earn enough income. So one of the reasons is childcare. The idea is to start childcare cooperatives so that they can work in the farms and they are able to earn good livelihood and so they don't get into situations of forced labor and precarious jobs. So these are some of the things that we're trying, and I just want to say that ThinkCop tool has been very useful in shaping up the narrative in both Sri Lanka and India. So I want to also congratulate and see that this tool is used more and more by people to support more care cooperatives. Thank you.
Bharti, thank you so much. It's obvious that you have so many good ideas and experiences and also examples from your region that you cannot really summarize it in 5 minutes. I really apologize for that. But what you have mentioned from Sri Lanka and India are really very interesting and inspiring examples that can be replicated in different countries. And also sustaining the cooperatives in the long run, I think this is also a very important question, which is also linked to the financing the cooperatives as well. But since you mentioned the benefit of the training tools that were developed by ILO, ThinkCop and CareCop and so on, I think it's good time for us to move to our colleagues to also present us the currently developed and launched tools, CareCop tools for us with us. So let me give the floor to Ryan and Mia for their presentation. Dear colleagues, I'm really sorry, but you have just only 7 minutes left. And then let's give at least 20 minutes for colleagues to raise their questions and have a question and answer session. So Ryan, I guess you start first. Please go ahead.
Thank you, Özge. Thank you. We'll try to stick to the time. Good afternoon, good morning, good evening, everyone. So this is the part that we're very excited about. We're very pleased to be launching today 2 new practical training tools on care cooperative development, which are Think Care Co-op and Start Care Co-op. These tools were developed as part of a program that was mentioned earlier by colleagues, which is a cross-regional multi-country program on care cooperatives, and they aim to advance practically care provision through cooperatives.
Thank you, Ryan. So Think Care Co-op and Start Care Co-op are designed for a wide range of beneficiaries, whether these are care workers, both paid and unpaid, to cooperative members and local communities. They reflect our commitment to support quality, people-centered services rooted in local communities and their needs. And we are proud to share that they are now available in both English and Spanish. Ryan, would you like to explain a bit more about why the ILO developed these tools?
Yes, of course. So these tools were developed as part of a broader ILO initiative to promote cooperative models in care provision, and they are based on national assessments that map the policy, legal, institutional, and programmatic contexts in areas like childcare and elderly care. These assessments, which were validated through multi-stakeholder workshops, revealed a clear need for practical and scalable solutions. Think Care Co-op and Start Care Co-op respond directly to that need, providing care workers, cooperatives, and local organizations with the tools to deliver people-centered, gender-responsive care services.
Thanks, Ryan. I think this is the perfect lead-in to show you what these tools contain. So let's start with Think Care Co-op, which is a one-day orientation and awareness-raising training that helps participants explore how their care needs can be addressed through the cooperative model. Next slide, please. It covers key topics such as the who and what of care, good relationships and livelihoods, horizontal and vertical relationships, the benefits of collective action, choosing the business structure, and providing care together. We really welcome you to explore these tools, but just to give you a bit of a taste as one of the activities that's in there. So there are a lot of group activities that are sprinkled throughout. The first one really being to get to know each other and our care needs, where participants explore what their direct care activities that they engage in are, such as feeding a baby, also the indirect care activities that they engage in, such as cleaning or cooking, and also who is supporting them in their care needs, whether it's their mother, their father, their husband, their wife, and who they provide care for. So it really puts participants in the mindset of the care that they are providing. So we really invite you to see all of the different activities, but at the end of the one-day orientation, participants are expected to not only understand what a cooperative is, how its values and principles can effectively contribute to meeting community care needs, while also understanding the benefits and the challenges related to the cooperative model, so that in the end, they can make an informed decision as to whether the cooperative model is the most suitable option for providing care solutions. Over to you, Diane.
Thank you, Mia. Next slide, please. So Mia presented Thinker Co-op, which, as she said, is an orientation tool. It's an awareness-raising tool on the benefits of cooperative as a viable business model in the care economy. Once participants basically are convinced and choose that business model, we move to the operational part of that business structure. And we have Start Care Co-op, which is a 5-day training that walks groups, participants, through the process of establishing a care cooperative. Next slide, please. And that training tool focuses on really step-by-step operational process of establishing a cooperative. So we start by identifying the core members, developing the business ideas, making sure that these business ideas are feasible. So making sure that the cost is appropriate. There is a marketing strategy. There is an outreach strategy. Studying the market, looking at competitors. So really going into developing a proper business plan for that idea and how a cooperative can basically implement and manage that business plan, and then moving to more the organizational setup, which is very specific to a cooperative, as cooperative have a specific governance structure as opposed to more traditional individual enterprises.
Next slide, please. So both tools are complemented by detailed facilitators guides, which include the step-by-step instructions, learning activities, and guidance on facilitation techniques.
Yeah, this is an important, thanks, Mia. This is an important part. The point of this is not just to say that there is a facilitator guide, right? There is, all of these tools are based, like a lot of ILO training tools, on a training of trainers methodology, which means that we as ILO do not train directly end beneficiaries. We do not train care workers or cooperatives or local organizations directly, but we go through national support institutions, local trainers, freelance trainers who have the national expertise, and then we come in with our global international expertise, and we follow a certification process, which is very important for the ownership of these tools, meaning that we have our own what we call master trainer that are certified by ILO and who are qualified to train these national trainers or national institutions and then certify them, making them in turn eligible to train end beneficiaries such as care workers or existing cooperatives who want to venture into care services.
Please, the next slide. And the next one as well. So now is the time for you to explore the tools yourself. Please feel free to scan the QR code. They're available in both English and Spanish, or you can also include the short bit.ly link /care co-op tools.
Yes, you can check these tools. They're available in English and Spanish. If you check the page, you can access the tools, the training guide of Think Care Co-op, Start Care Co-op, their related facilitators guide. And then there's also a brochure that explains a little bit more about the content of these guides and the certification process to be able to properly train care workers or cooperatives in your countries. So over to you now.
Thank you, Diane. So as we've seen, these tools are adaptable and participatory. They are intended for use by a wide range of actors, whether these are community organizations, SSE networks, training institutions, trade unions, and local governments, all working to build inclusive and sustainable care systems. So Think Care Co-op go beyond training. They are foundational resources for transforming the care economy through a people-centered cooperative lens.
So please visit the website, go through the tools, engage with your community members, and consider how they could work for you. We want to say that these tools are not a one solution for countries. They are adaptable. They can be adapted to context, to certain subsectors in care, to certain audiences, beneficiaries. So that is completely possible. So if you're interested in using or scaling these tools, please reach out to us. We're ready to support constituents and partners in the implementation, and together we can build more inclusive care systems that advance decent work, gender equality, and social justice for all. Thank you very much. Back to you, Osman.
Ryan and Mia, thank you so much. This is such an excellent presentation of very important tools, and warmest congratulations to you, to COOP team and to JD team to develop such an important tools for everyone. So now this is time for the discussion and reflections from our participants. I see there are already so many questions posted by our participants, but let me start first. The first question, which is very much linked to the tools. Anna from our participants asked, how can we access to that master training certification? And also Rodrigo has also posted a question on, do we need a previous study to implement the package as well, the training package, as far as I understand. So let's start with two questions, and then we will proceed with others as well. Over to you.
Yeah, I can take that, Özge. So the first question is about how to become basically a master trainer. So before becoming a master trainer, you need to become a national trainer. So there's a process we follow, right? We have our own master trainers that are already certified by the ILO, and these would basically organize training of trainers workshop and, you know, be advertised for trainings, and then trainers can, according to certain criteria, attend the TOT basically, and then follow the training. So 1 day for Think Care Co-op, 5 days for Start Care Co-op, and then they would have to go and train themselves, either care workers or existing cooperatives, and report back to our master trainer. And after all of that process, the master trainer would send a recommendation to us, basically, the Co-op SS unit and the JEDI branch, to say, you know, these are the national trainers that are certified, and they are eligible now to go on their own to represent the ILO and to take ownership of these tools and to train beneficiaries on independently. Okay, so this is the point of the certification, is to institutionalize that whole process, and so that the ILO takes, you know, their hands off the process at some point. That is at a national level. Then to become a master trainer, it is a longer process. This is a new tool. We're still working on developing a network of national trainers first, and then once national trainers have enough experience, they can then become master trainers according to another process. So that is the first question. The second question is, do we need to do an assessment? Yes, I would say usually, like any training, there's always a training needs assessment to be done. I mean, we've done these tools, we've tried, you know, these are kind of generic tools right now. We've tried to reflect the realities of the field experiences as much as we can. Carolina presented Colombia, for example. An assessment was done. It was a bigger assessment, but it went a little bit into the needs of the communities. That was integrated into the tools to reflect the specific needs of indigenous communities, of midwives, and so on. So specific groups in the care economy. That is all integrated in the tools. Something else that usually we do when we adapt the tools is to look at the legal framework. We need to see if the existing co-op laws are supportive of establishment of care cooperatives in the country or not. Do we look at other forms of SSE entities? Do we look at associations and so on? All of that needs to be, this homework needs to be done. and it's usually done by experts in the country in close coordination with the master trainers, so that they do the quality control and so that we keep also the core of the material. I mean, for example, we don't want to lose the cooperative principles and values at some point. And then we can start providing the training. So an assessment beforehand can be very useful.
Okay, Ryan, I have also another question posted by Rand, and asking if there is a need to start with the original Think and Start COP training when the training for care-related COPs, or can we start the new package automatically? So are those two packages are interlinked, or we can use them separately?
Yeah, it depends what we want to do. Usually we use them together. If there is an opportunity identified to help facilitate the establishment of a cooperative in care, or the existing cooperative in agriculture, let's say, which is interested in adding, in going into care services, they go together. The reason why we do this is that, especially for non-existing structure, is that we don't want to come with an already imposed model, kind of top-down approach. Think Care Co-op is about saying, okay, we have different models of how an enterprise would function. We have individual enterprise, private enterprise. We have the non-profit model, NGO, civil society model, and we have the cooperative. So we present all models, we present the benefits, the pros and cons of all models, and then people choose. In some cases, at the end of Think Care Co-op, people say, you know what, cooperatives is not for us. We're going to go into a different direction, and then it ends there. In other cases, they find themselves in that model, and then we go into the next level, which is the operationalization of the cooperative business model. Now, we have used Think Care Co-op as an awareness-raising, informative tool about cooperatives and the principles and how cooperatives function, without going into the operational part. But that was more for different contexts, not specifically for trainings. It could be to help an institution, I don't know, do an awareness-raising campaign on cooperatives in their country in a specific sector. So we've used elements of Think Co-op to do that. But for training purposes and the establishment of a cooperative, they usually go hand in hand.
Thank you, Ryan. So we have so many questions, dear participants, dear colleagues. Thank you so much for posting such very critical questions and also sharing your reflections. There is one question also to Carolina to Colombian case. So I mean, Ida mentions that you indicated that one of your success was to redistribute care responsibilities to free up time for women to be engaged in productive work. So how did you do this, and what are some strategies you applied? So Carolina, can I give the floor to you? And you may also wish to respond some of the questions posted in Spanish if you have seen all those questions. So the floor is yours, Carolina.
Yeah, thank you. Well, first of all, I think that the construction of the plans with the community helps to recognize the care work and to help them to move these concepts to the direct community. Yeah, and that's what we have done, for example, in the indigenous community, where they were at the beginning, they were very preventive from these kind of things. They were telling we have some roles, some specific roles for women and men. Now they are presenting men that are caring. For example, in our cooperative, we have a man who always is presented in the trainings with his kid, and he was taking care of him, and he said, well, this is what we have been learning, but what I have realized is that I can redistribute the care responsibilities with my wife and with me. So the kid was always with him. It's like, and he was like, when he was telling him, we are going to have training, the kid was so happy. Like, okay, we are going to training right now. And for example, for the question in Spanish, regarding the how are the decent work principles being promoted, cooperative principles enable a progressive approach to labor formalization. Often are more effective than in the private sector, and they also have the potential to connect with other economic empowerment initiatives, which allow women to advance, for example, in productive projects while ensuring the provision of high quality care services. For example, in the indigenous community, the mochilas and the bags that they are weaving, it's part of the sustainability plan of the care house that they are having. So this is, yeah, it's not easy, but if you have the collaboration of the state, the government, and other actors in the community, it can be done progressively.
Carolina, thank you so much. As I said, there are so many questions, but I think there is one very important question I would like to raise this to Audrey, if I may. So colleagues, one of the participants is asking, how are decent work principles being promoted within the care cooperatives? So what mechanisms are being used to ensure that these organizations do not replicate precarious labor models? So Audrey, can I give the floor to you just only 1 minute? Because this is a very important question. Thank you.
Thank you very much. So currently, what the communities are doing is really, the care work is unpaid. They agree to say, you know, we come together, we have, if they are street vendors, they will say, they will give the duty of care to one of them, while they are also able to move or to push products from the other person's stall, just so that they also, the other person who's taking care of care is also able to benefit from the sales within the limited time. But the issue is that right now it's not paid for. So this is why we are saying the same mechanism, but now have a paid element to it, so that even as it is working fairly because of the social protection and social understanding context and concept, we need now to put a dollar value to it. Thank you.
Excellent, Audrey. Thank you so much. Thank you so much. And now I would like to give the floor to Susan Thomas as we discuss on the challenges and the opportunities for financing the cooperatives and the SSEs as well. I think, Susan, your experience will be very interesting from SIVA. So if you are still with us, could you also would like to share with us your experience? I can't hear you and see you, Susan, but I hope you are. No, okay, perhaps. Okay, perhaps. Okay, colleagues. So we have some also more questions as well raised. So I would like to also just, take your... Simal, please go ahead. I see your hands up. I can't hear you, Simal. I'm really sorry.
Sorry, I was muted. I can make some financing comments if you think useful, or I can wait till the end. But
no, please go ahead. Please go ahead.
So financing co-op SSE initiatives in care and beyond will be one of the next steps in the process for us, documenting what we observed, what we've seen materialize, and what we also facilitated. What we see is that there are multiple co-financing mechanisms in place in these different experiences. Important to note that these are not like one project financing or national government fully financing initiatives. In any event, these are emerging because there is lack of these affordable, accessible, quality services. So rather, we are seeing a pooling of resources. They include local government, trade union, co-op movement contributing how? Providing space, providing training, contributing to running costs, members and communities also contributing with funds, fees, materials, or with their own time. In the case of vulnerable workers and their care needs, carers and their care needs. I mean, it is, and this is something, if Susan Thomas from SEWA was with us, SEWA Care Co-op was with us, she would tell us is, you know, there is, this is a part of social policy. This is a part of government and, you know, responsibility. So it's important, therefore, to tap into these are community initiatives, but they then need to link up with and be partnered with. And I see Susan Thomas is ready to speak, so I shouldn't speak for her, but we see business associations also like chambers of commerce being involved. For instance, in Better Work garment factories, the trade unions, co-ops of workers running care centers, that is provided, the space and running costs being provided by the employers. I'll stop here. Maybe you want to give the floor to Susan.
Yes, Simay, thank you so much. So it's Susan, please go ahead and the floor is yours.
Thank you. Can you hear me?
Yes, I can hear you perfectly. Please
All
go
right.
ahead.
Sorry about that. I was not able to unmute myself. First of all, congratulations to everyone. It was quite impressive. Great initiatives. So I won't take more than a minute or a minute and a half. First of all, I think the community-driven and participative models are always successful because the community is in charge, they own it, and they are able to ensure quality because they know what they need. Our models started as a cooperative model. But what is important, what you've learned is we have to keep sustainability in the center of our thoughts, our processes, our implementation, our programs, always. We have to be focused and we have to not lose sight of sustainability. And we have to keep exploring how you can make your models sustainable. Keep finding financial, opportunities and explore different channels all the time. And that's what we've done. Of course, what we have to remember is when we are looking at informal workers, they cannot pay. Most of them or all of them are looking at free services or low-cost models or affordable costs. So we have to keep that in the center, ensure quality, and explore different models like what Simel just said. We have private institutions who are, are supposed to run centers for their staff. So we are exploring those channels, those avenues to make money or make profit for the cooperative and then cross-subsidize and take it back to the community. So we have to keep exploring, keep having ideas all the time, and never lose sight of sustainability and continue to ensure quality while we are doing this. Thank you very much.
Dear Susan, thank you so much. Thank you. And we have also so many, again, remaining questions, and we have already passed our, time, but I think thinking about the, passion and also commitment from all participants, we can continue with some more questions to respond. So we have one question from Uzbekistan, from our colleague Nilüfer from ILO, asking, in cooperative members, are they private household? I'm particularly interested in how issues like health and safety, ethnic standards are addressed. And in my country, in Uzbekistan, there have been cases of aggressive behavior toward children, even in licensed private care institutions, and some of which are caught in surveillance cameras. So this is, I think, very important question regarding the safety. So ensuring safeguards in home-based care is a real concern for maybe for Uzbekistan, but maybe for other countries as well. So colleagues, who would like to take this question? From our panelists, is there any? Yes, Simel, please go ahead.
I don't want to hog the floor, I need to unmute. They're not allowing
No.
me unmute. Okay. I don't want to hug the floor, but just to answer Nilüfer and Nilüfer, we can continue this in a Uzbekistan-specific conversation as well. But one of the things that we see is there is a lot of these as our multi-stakeholder initiatives. So you have the workers as part, the beneficiary households as part, local government as part. On the regulatory side, I think this also goes into the question of what is the care policy in the country? What is the co-op policy in the country? And is it allowing for these kind of initiatives, care co-op or other SSE initiatives in terms of the enabling environment? In some cases like Zimbabwe, although it doesn't articulate, specify, it is not unconducive. In other cases, there is, for instance, we see challenges around like taxation, etc., and their efforts are underway for social co-op initiatives. But the regulatory elements have to apply there too. And again, this is something also the trade unions are asking for us when we are looking into these care co-op initiatives, how to build in the labor inspection element and this is again another frontier that we need to address. The fact that it's happening at the local level means local government needs to be, also very much closely involved, not only as co-funder or stakeholder, but also as a regulator. It's as you go along, no? For instance, in the case of Italy, okay, it's not maybe the countries we're talking of, but we've seen like care co-ops being very much a key partner for local governments in delivery of care services. But then an individual, let's say, care co-op may be too small, 50 or 70 members. So then what they do is build consortium. And then that's like 5-6 co-ops coming together to bid for local government services. And then, yes, local government then has that kind of inspection, quality control, regulatory responsibility because it's services that it is also financing. I know it's not a full answer, but a partial one. Thank you.
Simal, thank you so much. And I see that, this operational standards issues and ethical standards issue is also a problem for Mexico that was posed by our colleagues. So Yunus, I was planning to give the floor to you because there's a specific question to you, but you have already raised your hands. So there is a question asking, how do you see the role of private sector in supporting the care cooperatives and the social solidarity economy entities as well? So would you like to take up this question as well? And also, please share your reflections regarding other questions as well. Please go ahead.
Okay, thank you. Yes, I think this is a good question, and I will respond to it based on our experience in Palestine on OBT. Because during in a fragile context like Palestine, I think the private sector can play a vital role in recovery by supporting the care cooperative, either through creating jobs or helping working families. Contributing can be included through corporate social responsibility, either financial or in-kind support. In-kind support could be facilities like IT, service, and also in partnership to provide childcare for employees itself. I think the public-private dialogue can play a key role also to at least to encourage and make private sector interest and keen in care economy solutions growth. This is, I think, the right, if we use the right incentives and collaboration, private sector engagement can enhance the sustainability and impact of care social responsibility. So I think, the key success is related to the engagement, involvement, and raise awareness of the private sector of the importance of the recovery or even the private the care sector itself. Thank you.
Eunice, thank you so much. And Ida also just posted another message saying that strategic partnership is very critical, and one of them is the private sector as well, as you mentioned. And also Barty mentioned in her presentation, collaborating with the EPZ administrations and the Ministry of Industry is also very critical, not for us to consider for future planning. So thank you so much. As our colleagues mentioned in the chat, that the recording will be available and we will share with you the presentations as well. And there is also one last question. I see that, Oksana mentioning that the speakers mentioned about professionalization of care providers, particularly skills development of domestic workers and other care providers as well. So who is doing it, and should it be government-led education or other models are possible? So perhaps Barty, you may take this question because you were the one referring to skills development of domestic workers and care workers. Please, the floor is yours.
Thank you so much. So in India in 2009-10, when we were talking about domestic workers and their career progression into other industries, that's when we started skilling the domestic workers. We engaged with Ministry of Labor to develop modular skill schemes for workers with very low literacy. And now it's a full-fledged Ministry of Skills, which is doing skilling training for domestic workers. We have a domestic workers or care workers sector skill council, which is doing the certification on skilling as well as RPL, recognition of prior learning. So there is a competency-based framework which also allows for career progression. So all this is part of the skilling ecosystem within the country. That would be the best way to move forward, because care needs to be recognized as an industry, and also to enable skilled wages for workers. Most of the time, domestic workers do not get the skilled wages. When we have minimum wage schedules for skilled workers, certification allows them to get this government stamp that they are skilled workers and also accessed skilled wages. So I would suggest that the countries should look at skilling ecosystem, which is a part of the larger skilling ecosystem for care workers as well. And since the sector skill councils also have industry partnership, they keep this curriculum up to date. They also understand the needs of the market, and the competency frameworks can be revised in a timely manner. So that's the process we used in India.
Barty, thank you so much. So colleagues, we have already passed and I think it's time to wrap up, and let me give the floor to Simel for her final remarks, and we will reflect your questions and also share this information, as our colleagues already mentioned in the chat, that the links shared in the chat will be added to the webinar page, and we will also try to reflect your questions and the answers. So Simel, the floor is yours for the closing remarks.
Thank you so much, Özge. My heart is full. So many of you are still with us. There were more than 100 people engaging actively, and now we are just a little bit below. I won't attempt to summarize, just to say that the three countries have similar challenges in relation to limited availability, affordability, quality care services. Decent work deficits abound among care workers. This is, across the board, as we saw also from the Q&A and chat. There's much unpaid care work where responsibilities of care are absorbed by women in the household at the expense of remunerated work. So this is across the board. The crisis context makes things even more acute and more pressing, as we heard from Eunice in the Palestinian context. This brings about the urgent need for solidarity and mutualism at the local, national, international levels. And this applies to how co-op SSE entities can service basic needs, but also extend to the needs around care. The logical flaw, as you may have noticed, of the intervention model across the countries are similar. But then how the communities, partnerships, pilot initiatives have evolved or have manifested is widely different. In the case of Colombia, indigenous communities, midwives, with seed funds from the ILO, but also national government buy-in and financing. In the Palestinian case, the Palestinian General Federation of Trade Unions emerging as a key partner, but also local government of Nablus, the co-op movement, as well as the Cooperative Works Agency of the Palestinian Authority and the Ministry of Labor being keen to engage as key partners moving forward for seeing, incubating this effort. And I mean, I need to say that in the case of these, especially care needs of vulnerable communities who may not be able to afford private sector services, the incubation, the cultivation, the accompaniment is very important. Not only legal, not only in terms of running these operations, but also in terms of financing and continued engagement. We've seen, for instance, in the case of the US, domestic worker cooperatives really becoming a franchise model, and most of them women of color and women from the Americas, from Latin America, Central America. And in that case, what we've seen also them going into niche markets, for instance, like clean, environmentally sensitive, responsive services, or elderly care, geriatric care and knowledge of elderly care, or care of people with disabilities. I think this is although the focus here may have sounded like or may have been more from the child care side, there is from the mappings we've done and the emerging experiences, there's a lot of this kind of local like local cooperatives, like retail co-ops in Japan, in China, in Korea, seeing how, or agricultural co-ops, seeing their members aging, setting up home care services, setting up daily centers for them to engage, get food, get exercise, and socialize. So a lot of co-op movement is also emerging as key parties into this effort, and the aging element and the people with disabilities element should not be seen, and it's an important stream there. In the case of Zimbabwe, the care needs of street vendors, market traders who are in the informal economy was a starting point, bringing the Zimbabwean domestic workers and their associations. We hadn't, as Audrey mentioned, Cheswinge Safe Market Initiative was part of a banana producers and cooperatives initiative, an offshoot of that. There was donor monies. Now replicating that in a manner that continues to be worker-owned, community-owned is the challenge that we are going to be tackling with. And in the case of South Asia, domestic workers, plantation workers, their associations, trade unions are key. Building effective partnerships among all these requires time, trust, shared goals, national dialogue. The assessments are key points, the training, the national dialogue, the training tools are key points. But this kind of local ownership as a solution to key needs through joint action is what we are proposing, not in isolation from government responsibility, but as partners, as locally developed social innovations that need to be then integrated and also push forward the thinking at the local and national levels. And the importance of employers and workers organizations, I would like to emphasize that social partners, all these normative frameworks are tripartite frameworks. This care co-op initiative is also something that needs to be owned and cultivated through our tripartite partners, along with the co-op and social and solidarity economy movements. Thank you
Simal,
very much. My heart is full, and back to you, Özge.
thank you so much. Thank you. So, everyone, dear participants, thank you so much for joining us, actively participating, posting questions, and sharing your reflections. That's such a really very heartfelt, experience as well. We are very much look forward to engaging with you and continue our dialogue with all of you. And we would like to also thank to our interpreters, the IT specialists, and also all colleagues who have made this happening, this workshop. Simal, her team, Ryan, and Yiking, and Susanna, and also colleagues from JEDI as well, Laura and Mia, and all our distinguished speakers from different countries. Thank you so much for coming. Meeting with us online. And you see in the last slide that you can follow us through our social media accounts, and you can stay connected with us. And please also check our website as well on the cooperatives and social solidarity economy, and you will definitely see all the presentations and the reports as well. So today that's all from our side now, but we will continue our discussion and our dialogue. Wishing you a very good day. Thank you and bye-bye.
Thank you, interpreters. Thank you, technicians. Bye.
Thank you, everyone.
Thank you.
Bye-bye.